I, Sabru Dhillon, PhD scholar and assistant professor, along with my co-author Dr. Harmeet Kaur Kang, principal and professor at Department of Nursing, Chitkara School of Health Sciences, Chitkara University, Punjab, have conducted a research study to assess the prevalence of depression and its relationship with the physical activity among cardiac patients who have undergone cardiac events. Though we know that ample level of physical activity reduces the reoccurrence of cardiac events among the cardiac patients, but studies have also shown that the person who is suffering from depression tends to be less physically active. So we started doing literature review and we found that the prevalence rate of depression among the cardiac patients who have undergone cardiac event is 19 to 20%. So, we did a quantitative research study in which we involved 196 cardiac patients who were taking treatment at the selected hospitals of Punjab, India, and the subjects were chosen purposively. We took the ethical clearance, then permission from the hospital authority was also taken prior doing the study. Informed written consent was taken from the patients and data was collected using physical activity questionnaire in terms of metabolic equivalence of tasks, and data regarding depression was collected using Beck depression inventory too. Of this study revealed that majority, that is 62.2% of the cardiac patients were suffering from moderate clinical depression, followed by 11.2% of the patients suffering from severe depression. The study also revealed that 86.7% of the patients were having low physical activity, that was less than 600 metabolic equivalents of task minute per week. Additionally, the findings of study revealed an inverse relationship between the depression and physical activity. That is, higher the level of depression, lower was the physical activity among the post-cardiac event patients. There was a statistically significant mild negative relationship between the depression and physical activity. As we know that the definition of health is a state of complete physical, mental, social well-being. So for the management of these patients, all three aspects, that is physical, mental and social, are of equally importance. But unfortunately, it has been seen in the clinical settings that the majority of treatment focus on the physical aspects or the physical symptoms or the physical causes rather than the psychological ones. So we recommend the early screening of signs of depression and early screening of the signs of physical inactivity by the nursing staff in order to formulate an individualized nursing care plan in order to help preventing the symptoms of depression, improving the physical activity, enhancing the overall health of these patients, and to reduce the healthcare cost. So, in the end, I want to say that the nursing staff should focus on both the aspects of health, the physical as well as the psychological ones, especially among the post cardiac event patients, because they suffer from physical symptoms also. They have certain mental stress also regarding the disease, its outcomes, and what will be their future. So, the staff should focus on both the aspects of health, and so that the patient can enjoy the upcoming life thoroughly. Thank you.